know this is random, but I thought I would do a live because otherwise I will never share what's going on. I'm going to do my makeup while I'm talking. If you've been watching my channel for the past handful of years, then you know that I have PCOS. I actually just turned 40. I became pregnant 2 times, lost my first one at 9 weeks, and then had my baby. Successfully had an amazing pregnancy. I had a good delivery, and here we are 3 years later. So I'm going to update you from the last time I was on here, which was probably last year, about just identifying my new doctor and sharing that. So the last time I was on here was last year in 2023, sharing that I found a fertility doctor, and I was all excited. Things just didn't pan out the way that I thought they would, and I just didn't feel comfortable with the services. At that time, the doctor changed his office at least 3 times. I was at his third office, and not in a short period of time. And when I would go to my visits, it felt like there was just a miscommunication of understanding where I was at with my cycle. And as women, I think we have that gut feeling like something's off. I don't understand this. And that's what I felt. And I just decided not to move forward with that. On top of also understanding my other condition that I was working through, and I was all nervous about having both of those, managing both of those at the same time, what I should do. Okay. So I had been on like the suppository, they're actually pills, but you can enter them in other parts of your body, if you know what I mean. And I had been doing that for 3 years. But one of the side effects was about your heart. And if you have something with PCOS, you know that we have to be careful with our heart. So I just had to narrow it down that I was getting a side effect of something messing with my heart, and it had to do with the progesterone, because I didn't understand why I was feeling this pain in this area while taking the progesterone suppositories, because I had taken them a long time. Thank you. And right now I'm talking about fertility. Thank you. Okay. Hi, Jose. Your dress is cool. This is from Target. Thanks. I don't even know what's going on. Wonderful. Hi. This is my kind of like my first live, so I don't know. Anyway, let me just talk on as I'm talking. Thank you. The necklace is James Avery. What was I talking about? Oh yeah, effects with my heart. So I had to look into that. It was just a lot of additional testing that I had to have done, managing PCOS and all that kind of stuff. You just have to always be mindful of other health conditions, like with your heart, cancer prevention. It's a lot. It's kind of like diabetes in a sense. Thankfully, we don't have to have as severe interventions, but you do have to be mindful of managing the PCOS. So I had to do all that in addition to balancing the fertility treatment, and with that I decided to just stop the fertility. Just stop and focus on the heart conditions that I was having and other things, because I can't do everything. I cannot do everything. So that's where we're at. All of that took place like at the end of last year, and I know it's the beginning. It's already basically we're going towards the end of 2024, but it's just a lot to manage that, to manage a 3-year-old, to take care of my marriage, to do all those things. And if you're married with kids, you know what I'm talking about, right? It's a lot. So I decided I just need to stop all fertility treatment. And honestly, I'm trying to figure out to go more the natural route, um, without medical intervention as much. At my age, I guess I'm supposed to be looking at IVF, but I'm really wary of those type of medications and how it will affect your body. So I've decided, I don't know. I don't know. I don't know. I really am trying not to do that. And I'm looking and I'm reading more about Chinese medicine. And as a person, you just have to make the best choice for yourself. And that's with any condition. You know, whatever condition you have, it's like researching what's the best way for you. Is it going to be Western medicine? Are you going to do a combination of holistic and Western medicine, or are you just going to go the holistic route? It really is just you're the shopper and you advocate for what's best for your body, and that's how it has to go. Like I said, that's for any condition. I feel like we're at a place where we can share information and we can share our testimonies and we can read on a lot of different approaches in medical care, and then we just got to make the best decision for us, because boo boo, nobody's going to take care. There's nobody that's going to carry your medical condition and know everything like you do. The one thing that irks me with medical is everything's separate, and you're the one that has to keep track of everything because your medical provider can't. It's everything is treated separate, and that can be troublesome. I'm just focusing on taking care of my 3-year-old, taking care of our house. I'm a homemaker, and I've been a homemaker for the past few months. I quit my full-time job last June, and so where are we at? 12 months. I'm hitting 13 months of being a homemaker and raising my son. And that's what, you know, I want to do at this point. Anybody that's going through fertility troubles, I understand it and I feel you. I definitely do. But again, I feel like the more research, the more you hear from other patients, the more literature you read, the better informed you are to make the best decision for you. Hello. So that's my update about my fertility journey. And that's all I wanted to share as of now, because I know it's been a hot minute since I've been on here. I hope you'll have an amazing Saturday, and I'll see you next time.